Let's bring in Dr. Lucas Troutman, medical director at the Oxford Treatment Center. So everybody says that the Reiners tried very hard to get their son treatment. Obviously, if he was in rehab 18 times by the age of 22, somebody was paying attention, but somehow it didn't take. What do you say to parents who might see their own children with problems like this and are maybe even afraid to go to rehab or take the kid to rehab?
John, thank you for having me. This is just such a vital story you're telling, and listening to the words of Rob Reiner, it's just heartbreaking. Certainly this family did everything they could to help their son. And when we talk about addiction treatment, we've got to talk about the neurobiology of addiction in general. This is a chronic brain disease where the neurochemistry gets rewired to seek more and more dopamine. Base levels of dopamine, the baseline levels of dopamine are low, so people feel like they're not normal, they say. So they seek and crave on a long-term trajectory this substance. So treatment centers, they're the first wonderful step in the longevity journey of addiction treatment. But oftentimes, because of a patient not being ready for treatment, because of resources or aftercare plans not being fully in place, or a patient not getting placed on the right level of care, sometimes treatment fails. Now, in this case, I've also heard reporting of co-occurring schizophrenia. That puts another really strong headwind against long-term sobriety. So while we had a family who loved their child and who did everything they could and sought adequate care, there are so many headwinds in his case that seemed to lead to relapse over and over. What I want to say to families who could have fear of treatment centers, I hope they hear in my voice as I represent addictionologists across America that we have deep love and care for these patients. We stand on the front line to give them evidence-based care. And just because addiction is messy, and just because people relapse, we don't withhold care. We're still here to treat anyway. And just like cancer is a chronic condition sometimes, we don't withhold chemotherapy. We keep going and fighting for these patients regardless.
There was an addiction study done in this country in 2023, and the numbers are, well, disheartening. Among people over the age of 12, 48.5 million people reported having a substance abuse disorder. 27% of adults with a substance use disorder were 18 to 25. And the last statement there, 1 in 4 people received substance use treatment. I'm not sure if that's a good thing or a bad thing. I mean, 1 in 4 seems like you're not really getting to the core of the problem. 3 out of 4 are not getting treatment, doctor.
That's right, and it's why your reporting on this is so vital. We're destigmatizing addiction treatment for people. We want more people in treatment because the majority of people who get treatment fly free from addiction. I work on a 110-acre horse ranch that's an addiction treatment center, and most of the people that come in have beautiful, vibrant lives afterwards. I think it's important to highlight that. Also, your statistics, what they show is that most American families are suffering with a family member with an addictive disorder. And whether you're in Hollywood or in New Albany, Mississippi, living paycheck to paycheck, the fear of getting that 1 a.m. phone call is so universal. This doesn't spare socioeconomic groups, and it's a very powerful adversary.
Yeah, and Rob Reiner talked about that. He talked about the fact that, Nick grew up in a famous family and how that may have had some effect on his struggles with addiction. Listen.
He has the double whammy. He's got me and he got his grandfather, and they're going to say whatever the heck they want, but they don't know. They don't know what he's experienced. They don't know what he's gone through. They don't know why he's done what he does, and and it's pretty dumb, pretty ignorant of people to say just because you're born and you have money and that doesn't mean anything.
Would you concur? I mean, a lot of people hear about, the Hollywood lifestyle and money in Hollywood, and they think, oh, sure, this had to happen. But it's happening all across the country to families that don't have a lot of money as well.
That's right. And I agree wholeheartely with Rob Reiner in that clip. What that demonstrates is a father who stuck by his son thick and thin through must have been very manipulative and and difficult behavior on behalf of the son at times. Yet you can just hear the passion in the father's voice, sticking with being committed to humanizing his son. It's beautiful and tragic to listen to, but certainly no one would say in the addictionology world that Rob Reiner or his family was a cause of the substance use disorder. In fact, I would say this is a pretty ideal family in terms of how to respond and stick with a family member who's suffering.
Dr. Lucas Troutman, thank you, and we hope you can successfully treat a lot of people who come to you for help. Thanks.
Thank you, John.